Hello, Guelph. Today we're going to speak with Dr. Anne-Marie Zajdlik. She's a family physician and an HIV specialist who is the founder of a provincially funded HIV/AIDS clinic in Guelph and Waterloo. She's the founder of Bracelet of Hope, a community-based organization that raises funds and awareness for AIDS in Africa. She also works at the COVID-19 assessment clinic in Guelph a day of the week. The rest of the time she's at her private practice and the HIV clinic. Ever since the pandemic hit, Dr. Zajdlik has been sharing posts almost daily on her Facebook page that talk about her thoughts and her feelings, and most importantly, hope. She shares a lot of hope that's been widely shared on social media. So we're going to speak to her today to learn more about what she sees on a daily and why it's so important for her to give hope to the community.
Yeah.
Dr. Anne-Marie Zajdlik, thank you so much for speaking with us.
Sure.
I wanted to speak to you about the posts that you've been sharing on Facebook. So before all that, I just want to ask you, what's a typical day like for you at the COVID-19 clinic?
The COVID-19 clinic up until 2 weekends ago was fairly quiet. Maybe 40 or 50 people coming through. What's remarkable about the clinic is that there are so many people involved in the team. Lots of administrative people, doctors, nurse practitioners, nurses, and you can tell that we're all very well trained because we're able to become a cohesive team with people we don't even know. So similar trainings coming together, creating this great team. And the clinic is run very well. There are usually 4 little cubicles running at a time with 4 patients that are being assessed, some of them swabbed, some of them not. The most interesting day at the clinic was last Friday or 2 Fridays ago when St. Joe's sent their staff in. So there was about 900, 1,100 people that had to be swabbed. That was fun. And I know I shouldn't say it's fun, but I like to be busy. So the people were quite afraid and upset. It's a Friday night. Here you are coming to the COVID clinic. What I was impressed with was how compassionate the staff were with all these folks and running like a well-oiled machine, because we were swabbing a new person every 5 to 7 minutes, just bang, bang, bang. Yeah, they were all asymptomatic people, so it was like we have to get everybody swabbed this weekend. So it's a really good team experience. Pardon me?
How many were they in total?
I think there were 900 over the weekend, and by the Monday there were 1,100 that went through. So the clinic had never seen those numbers before, but those are the numbers we need to get through this pandemic, is to start testing as many people as we can. And the COVID clinic in Guelph has been so set up so well and managed so well that we are ready to see that volume of patients if we need to.
Right. And so this is what I wanted to talk to you about, because you're so busy. You're so busy, yet you still take the time out of your day and you share these detailed posts of your thoughts and feelings and what you've seen throughout the day. And sometimes it's not even related to medical stuff. It's just like you walking out on, like, looking at the nature in spring.
Yeah.
And then you also share that you get exhausted and you get inspired and you get tired and you get sad. You feel all these emotions too. So why is it important for you to be sharing this?
It started very accidentally. We had a meeting at this office really early on, just after the pandemic was declared, and a group of physicians were going to meet here to start discussing how to get things organized with our call group. And we decided to stand outside 6 feet apart, which at that point was really weird. We see this all the time now, but that was weird. So someone took a picture of us doing that, and I posted it. And there was just a lot of interest. A friend called a couple days later and said, "Can you keep posting, because you're getting a good number of followers?" And what I found with the first few posts is that people were terrified. Are we terrified as healthcare workers? Most likely, but our first priority is to make sure that everyone's well. So what I saw was a need during the first few posts to try to get people to be less afraid. And the way I do that in the office when I see someone who is afraid is to develop a very close therapeutic relationship, which includes sharing some things about myself and my own experiences, and just providing reassurance and compassion and try to keep things calm. So I'm basically doing the same thing I do in my office, but I'm doing it with like 7,000 followers now. Yeah.
And in the beginning, your post, they were telling the story of how medical workers were working together to create this clinic. That was just over like a month ago. And
Yeah.
now we're at a point where we've flattened the curve. So how would you describe the journey of the pandemic from preparing it in the beginning to where we are now? Like, what has gotten us through this? What has gotten us this far?
Leadership. It's terrific leadership. Um, I'm going to continue to be very proud of how quickly the leaders across the province, across the country, and in particular in Guelph, because those are the leaders I'm close to, were able to step up and say, we've got this, under the direction of Ross Kirkconnell, who is the executive director of the Guelph Family Health Team, and some key nurse practitioners and doctors who stood up to help him lead. Without that effort, Guelph would not be where we are in terms of our numbers. And compared to the rest of the province, we're doing extremely well in terms of the number of patients who are infected and the number of patients who are recovering well in hospital. And our death rate, that's an awful term to use, is much lower than many other parts of the province. That's early leadership right out the gate. And Ross's motto has been, let's not let perfection stop us from doing what needs to be done to save people's lives. It's been wonderful to watch that.
Okay, and you also dealt with another pandemic, HIV/AIDS.
Yeah,
So
yeah,
this isn't like the first time you're dealing with this. So you seem to be in a position where you know what to say to kind of just calm people.
yeah,
A reoccurring theme I saw in your post is that healthcare workers know exactly what they're doing.
yeah.
Yeah,
Yeah.
and these people are the ones that will risk their lives for you. Like, is
They're
this
trained to do that. Yes. Yeah.
because you see the fear and anxiety in patients that
Yeah.
you have to remind them that look, we know exactly what we're doing.
Yeah.
Yeah.
I think that's very reassuring people to understand. You can watch the news and you'll see images, the worst images, right? Which are images that are not happening in Canada. So when we look at what's happening in poor New York City and the overrun emergency rooms and people that are just panicking and it's disarray, it's frontline warfare, that's not happening in Canada. And it hasn't happened in Canada because of our federal and provincial leaders, local leaders, and people who've stepped up to do this job. For that reason, Canadians don't need to be terrified. And so what I wanted to try to do in the post, and I continue to try to do, is take what they're hearing on the news and say, wait a minute, you're actually well protected. You're surrounded by a group, a medical team that has your back. Trust us, stay at home. We've got this, and you're going to be okay. Yeah.
You've also shared a lot about there's been a lot of community members donating gowns and masks and
Yeah.
surgical hats. That's been constant. How do you feel about that? Like, how does that help you deal with this?
Well, I was just speaking to my nurse practitioner about refusing to panic because the morning was very busy, and sometimes you just feel like you're going to panic. And I have to tell myself, I'm just not going to panic. I'm just not going to go there. And there's many forces that are telling us you should be panicking, and I have to refuse to do that, and I want to refuse to do that. So when we call it the backdoor drop off, when people are coming to the back door of my office and dropping whatever they've donated and then rushing 12 feet back so they don't come near me, it's so funny. So I open the back door, they take off, we wave at each other, give a mutual hug, say thank you, and then I have this gift and their contribution to a fight that we're going to win, and understand how good people are, how generous they are, and how much they want to contribute. That makes us all a team. It's very empowering, and just, yeah, very empowering. Yeah.
So, just where do we stand as a city and a province, and like where do we kind of go forward with this? What would be your final words, like your ending words about like how we're going to deal with this, and what we should do now?
I am very impressed with where we are now. We're doing extremely well. There are only maybe 4 other sub-federal governments and federal governments that might be doing a little bit better than Canada is. I think, and there's a provincial difference as well, depending on the number of infections each province had. So I think in a matter of weeks, we will see no new cases or very few new cases. I love how cautious our governments are being. We've already prevented our ICUs and emergency rooms from being overwhelmed. We're past the surge, most definitely, and the surge was not significant enough to overwhelm us. As long as we keep going and following this strategic plan, we're going to be fine. And then we'll let the international scientists work together to come up with a vaccine, or an antiviral is also something that's possible. But we just have to stay the focus and not become discouraged, not be anxious, keep staying home and follow the leader.
Okay, very well said. Thank you so much, Dr.
My pleasure. Is that it? I wish I could give you a coffee.
Oh, no, hold on. Let me stop recording so I can continue.
No.